From New York City, this is Democracy Now! From the epicenter of the pandemic.
This virus will be with us for a long time. And we must come together to develop and share the tools to defeat it.
As the number of confirmed COVID-19 cases worldwide approaches 4 million, and the pandemic could be with us for months or years, we look at who can access drugs like remdesivir, being developed by pharmaceutical giant Gilead, which has the patent for the drug and is poised to make massive profits, even as the company announces it will donate some of the medicine.
We want to make sure nothing gets in the way of these patients getting the medicine, so we made a decision to donate about 1.5 million vials of remdesivir.
That's very exciting, and just so you know, Sudan's making the company a very major contribution towards helping people.
We'll look at patents versus the pandemic with writer Ashel Prabhala, who says we'll find a treatment for coronavirus, but drug companies will decide who gets it. But first, we go to Russia, where the coronavirus is spreading rapidly with at least 10,000 new cases a day and the second highest infection rate in the world. President Vladimir Putin's approval rating is plummeting.
The coronavirus preventative measures need to be preserved or be expanded. Somewhere it is possible to plan the reasonable lifting, but only based on the opinion of scientists and specialists, while taking into account all factors and possible risks.
We'll go to Moscow for an update with The New Yorker magazine's Joshua Yaffa. All that and more coming up. Welcome to Democracy Now!, democracynow.org, The Quarantine Report. I'm Amy Goodman. The U.S. coronavirus death toll continues to climb, even as 41 states have announced plans to partially reopen their economies. Officially, more than 73,000 U.S. residents have died of COVID-19, more than a quarter of the global toll, though many researchers believe the true figure is likely tens of thousands of deaths higher. This week, a University of Washington study predicted more than 130,000 U.S. residents will die of COVID-19 by the end of the summer as states loosen stay-at-home and social distancing rules. In Texas, leaked audio of a conference call reveals Republican Governor Greg Abbott knew his plan to reopen Texas's economy would result in more coronavirus infections and deaths. 19-page report by the Centers for Disease Control and Prevention offering step-by-step advice to local leaders on when and how to reopen public places has been shelved, with one CDC official saying the document, quote, would never see the light of day. On Capitol Hill, the House Appropriations Committee heard testimony Wednesday from two medical experts who said not a single state or territory in the United States has met all the White House's own criteria for safely reopening. Dr. Caitlin Rivers, a professor at the Johns Hopkins School of Public Health, said states lack adequate diagnostic testing and the capacity to carry out contact tracing. And she warned many of the states that are reopening have rising rates of coronavirus infections.
It's clear to me that we are in a critical moment of this fight. We risk complacency in accepting the preventable deaths of 2,000 Americans each day. We risk complacency in accepting that our healthcare workers do not have what they need to do their jobs safely. And we risk complacency in recognizing that without continued vigilance, we will again create the conditions that led to us being the worst affected country in the world.
Not testifying Wednesday was Dr. Anthony Fauci, a top infectious disease scientist on the coronavirus task force, who was barred by the White House from appearing before the House Appropriations Committee. A new report finds the U.S. private sector lost more than 20 million jobs in April as coronavirus lockdowns came into effect, by far the worst one-month surge in job losses ever recorded. The U.S. unemployment rate is now at levels not seen since the Great Depression. This morning, the Labor Department is releasing its latest weekly unemployment figures, with economists expecting another 3 million new jobless claims filed in the week ending May 2nd. Meanwhile, an alarming new report by the Brookings Institution finds nearly 20% of U.S. children ages 12 and under, that's a fifth of these children, are going without enough food during the coronavirus crisis. And the Washington Post reports not all U.S. residents are impacted equally. A poll found that 20% of Latinx workers and 16% of African Americans report being laid off or furloughed, compared with 11% of whites. In Ohio, Republican Governor Mike DeWine said Tuesday he's cutting $775 million from the state budget over the next 2 months. The austerity includes $210 million in cuts to Medicaid and nearly $500 million in cuts to education. Governor DeWine said he won't tap the state's $2.7 billion rainy day fund.
We've received a lot of questions. Are you going to pull down the rainy day fund? And the answer is yes, we will. We're just not going to do it in the next 2 months.
Governor DeWine's budget cuts came as President Trump said congressional proposals to fund state governments during the pandemic were unfair to Republicans because, quote, all the states that need help, they're run by Democrats in every case, Trump said. He made the remark Tuesday from Arizona, a state whose Republican-led government projects a budget shortfall of as much as $1.6 billion by the end of the fiscal year. The United Nations said Wednesday it needs billions of dollars in additional funding for humanitarian aid as the pandemic sends food prices soaring, even as millions of workers have lost their jobs. The UN's Humanitarian Affairs Office says only about half the $2 billion in emergency funding it requested in March has arrived, although the office now says it needs nearly $7 billion to help the most vulnerable countries. Meanwhile, the head of the World Health Organization warned Wednesday governments that lift remain-at-home orders too quickly run the risk of new waves of coronavirus infections and deaths. This is Dr. Tedros Adhanom.
The risk of returning to lockdown remains very real if countries do not manage the transition extremely carefully and in a phased approach.
In Brussels, European Union leaders warn the 27-nation bloc is facing the worst recession in its history, with forecasters projecting a 7.4% drop in economic output. The dire news came as Germany began a phased reopening of the economy, with schools, daycare centers, and some restaurants set to reopen with social distancing rules in effect. In Italy, COVID-19 deaths have hit a nearly 2-month low, while France is set to end its lockdown on May 11th. The Spanish government has announced an investigation into whether the closing ceremony of Spain's largest field hospital during the coronavirus crisis, which took place May 1st, violated Spain's emergency decree and social distancing rules. Over 1,000 people crowded into the closing ceremony of the IFEMA Field Hospital, set up in a vast convention center that played host last December to the United Nations Climate Summit. Images of the event show people packed together, not observing the 2-meter social distancing rule. Venezuelan state television has aired video of a captured U.S. mercenary who was arrested after taking part in a failed attempt to topple Nicolas Maduro's government. The coup attempt occurred Sunday when 10 armed men landed in a boat near Caracas. Venezuelan authorities killed 8 of the men. 2 men, both Americans, were captured. In the video, Luke Denman said he was working for a Florida-based private security firm called Silvercore USA, run by a former Green Beret, and for Juan Guaido, the U.S.-backed Venezuela opposition leader.
My responsibilities to Silvercore are written in a contract, or described in a contract, signed by Jordan Goudreau, Juan Rendon, and Juan Guaido.
President Donald Trump Wednesday vetoed a bipartisan Senate resolution aimed at limiting the president's authority to attack Iran without congressional approval. It's the 7th time Trump has used his veto power since taking office. Democratic Senator Tim Kaine had introduced the measure after Trump ordered the assassination of the Iranian commander Qasem Soleimani in January. President Trump got into a testy exchange Wednesday during an Oval Office meeting with medical workers marking National Nurses Day. Sophia Adams, president of the American Association of Nurse Practitioners, told President Trump she'd been forced to use a single N95 mask for weeks due to a shortage of personal protective equipment at her New Orleans hospital.
So PPE has been sporadic, but it's been manageable, and we do what we have to do. We're nurses, and we learn to adapt and do whatever the best thing that we can do for our patients to get the job done and get the care provided.
Sporadic for you, but not sporadic for a lot of other people.
Oh, no, I agree, Mr. President.
Because I've heard the opposite.
They were speaking in the Oval Office. At least 27 U.S. medical workers have died of COVID-19 amidst critical shortages of PPE. National Nurses United has been demanding for weeks President Trump use his authority under the Defense Production Act to speed production of N95 masks and other desperately needed safety equipment that saves lives. In Michigan, 3 African Americans carrying large rifles escorted State Representative Sarah Anthony, who's also African American, into the state capitol in Lansing on Wednesday. Michigan state law allows people to carry firearms inside the Capitol building, though it bans protesters from carrying signs. Last week, a large crowd of heavily armed white protesters swarmed into the building and tried to take the Senate floor. On Tuesday, Governor Gretchen Whitmer condemned the protesters, saying some of them carried nooses, Confederate flags, and swastikas. They were calling for the reopening of Michigan. In Colorado, medical workers celebrated at a VA hospital in Aurora Wednesday as COVID-19 patient Reverend Terrence Hughes was released. The 56-year-old leader of Denver's civil rights community was the Aurora VA's first coronavirus patient admitted on March 9th. He spent 7 weeks on a ventilator and at one point fell into a coma before his recovery. A top Republican fundraiser and longtime ally of President Trump has been tapped to head the U.S. Postal Service. Louis DeJoy will serve as Postmaster General at a time when the nation's mail service is facing steep losses in revenue. The Post Office, which has come under attack by President Trump, recently warned it may not survive through summer without major federal assistance. ProPublica reports that on the same day Republican Senator Richard Burr sold off much of his stock holdings ahead of a coronavirus-fueled market crash, Burr's brother-in-law also dumped significant stock holdings. Burr's brother-in-law, Gerald Fouth, sold as much as $280,000 worth of shares on February 13th, 1 week before the stock market began plummeting. As chair of the Senate Intelligence Committee, Burr had access to privileged information about the severity of the emerging pandemic. In immigration news, a 57-year-old man from El Salvador is the first person to die of COVID-19 while in custody of Immigration and Customs Enforcement. Carlos Ernesto Escobar Mejia came from El Salvador with his family in the 80s during the country's U.S.-backed civil war. He was the youngest of 5 siblings and the only one who hadn't been able to obtain permanent residency. Escobar Mejia had been detained at the for-profit Otay Mesa Detention Center near San Diego since January. At the time of his passing, he'd been in the hospital on a ventilator for over a week. The San Diego Union Tribune reports as of Tuesday afternoon, over 200 people in custody at Otay Mesa have tested positive for COVID-19, as the jail has the largest coronavirus outbreak of any ICE jail in the United States. This is asylum seeker Oscar Navarez Diaz, who's jailed at Otay Mesa.
Like, he was so sick and he kept complaining about it. He wouldn't come out of the room. And the only thing that they would do when he complained, they would take him to sick call, and the only thing they would give him is pain medication or cold medicine. They don't care here. They don't care about us human beings. They don't even see us as human beings. They see us, since we're immigrants, we're less than human to these people. They don't care about us at all. We're fleeing our home country because we're afraid for our lives. We come here as a safe haven, and now we're put in a situation where our lives are in more danger than they were back in our home country even.
Otay Mesa is owned by the for-profit Core Civic. Nationwide, condemnation is growing over the killing of Ahmaud Arbery, the 25-year-old African-American man who was shot dead while jogging by 2 white men in Brunswick, Georgia, in February. Shocking video emerged this week showing the 2 white armed men waiting to attack Arbery while he ran down a narrow road. The men have been identified as former police officer Gregory McMichael and his son Travis. A friend of theirs filmed the video showing the ambush and the killing of Arbery. Basketball superstar LeBron James tweeted, "We're literally hunted every day, every time we step foot outside the comfort of our homes," he said. Democratic presidential candidate Joe Biden condemned the killing, writing on Twitter, quote, "The video is clear. Ahmaud Arbery was killed in cold blood. My heart goes out to his family, who deserve justice and deserve it now. It's time for a swift, full, and transparent investigation into his murder," Biden wrote. There have been no arrests so far in the case, which is now going to a grand jury. Cell phone footage has emerged of a Los Angeles Police Department officer repeatedly punching a man being arrested in the neighborhood of Boyle Heights in late April. The video shows the man with his back toward the officer standing near a fence with his hands behind his back when one of the officers begins punching him behind the head and body, hitting him over a dozen times while yelling profanities. The man then tries to take a few steps away from the officer as the officer walks toward him again, punching him several more times. The man doesn't fight back. The police officer has since been ordered to stay home pending an internal investigation. He's been identified as a 20-year LAPD veteran named Frank Hernandez. The Los Angeles Times reports Hernandez has been involved in 3 on-duty shootings during his career. In 2010, he shot dead a 37-year-old Guatemalan immigrant named Manuel Jimenez, sparking protests. In India, at least 9 people have died, including 2 children, and hundreds of others are hospitalized after a gas leak from a chemical factory in the southeastern region of the country. The styrene leak came from a plastic plant owned by South Korea's LG Corporation and was attributed by Indian police to 2 massive tanks left unattended since late March amidst the coronavirus lockdown. It was the worst mass poisoning in India since 1984, when a gas leak from a pesticide plant in the city of Bhopal killed an estimated 20,000 people. And Education Secretary Betsy DeVos Wednesday unveiled new sexual assault policies for college and school campuses that weaken the rights of sexual violence survivors while bolstering protections for people accused of sexual harassment or assault. The new rules, set to take effect in August, also reduce the legal liabilities against colleges and schools and narrows the scope of which cases schools and colleges are required to investigate. Advocacy groups supporting survivors of sexual violence have vowed to fight the new policies. Vinita Gupta, the president and CEO of the Leadership Conference on Civil and Human Rights, denounced the rules, saying, quote, "This is all part of this administration's ongoing attempts to undermine the civil rights of students. All students deserve an educational environment free from sex discrimination and violence," she said. And those are some of the headlines. This is Democracy Now!, DemocracyNow.org, the Quarantine Report. When we come back, we'll look at the rising rate of coronavirus in Russia, and we'll look at patents and the pandemic. Stay with us.
Ain't no mountain high, no valley low, no river wide enough. Now if you need me, call me, no matter where you are, no matter how far. Don't worry, baby.
by Boston Children's Chorus and choirs from around the world, featuring Massachusetts-born opera star Andrea Baker. The video is dedicated to the staff of Massachusetts General Hospital and all healthcare workers around the world. This is Democracy Now!, DemocracyNow.org, the Quarantine Report. I'm Amy Goodman here in the epicenter of the pandemic, broadcasting from the studio. Co-host Nermeen Sheikh is broadcasting from home to protect against community spread. Hi, Nermeen.
Good morning, Amy, and welcome to our listeners and viewers around the country and around the world.
Well, we're turning first to Russia, where the coronavirus is spreading rapidly with a rate of new infections that's the highest in Europe and second only to the United States worldwide. After weeks of reporting a seemingly low number of cases, infections have exploded in Russia this week, with 10,000 new cases a day since Sunday. The number of reported cases is more than 177,000, with more than half the infections in the capital, Moscow. But Moscow's mayor says the numbers there are likely 3 times higher than reported. Meanwhile, Russia's COVID-19 death toll has passed 1,500. More than 100 medical workers have died fighting the virus, and many have reported lack of personal protective equipment. 3 doctors mysteriously fell from hospital windows over the past 2 weeks. 2 of them have died. 1 is hospitalized. The hospitalized doctor previously posted a video on social media calling out the lack of medical equipment and the fact he had to keep working despite testing positive for COVID-19. Russian authorities say they're investigating all 3 cases. This comes as the Russian Prime Minister, Mikhail Mishustin, who had been appointed by President Vladimir Putin to lead the response to the virus, has been diagnosed with COVID-19 and is self-isolating. 2 other cabinet members have also tested positive for the virus. On Wednesday, President Vladimir Putin said Russia should not rush to lift coronavirus-related restrictions.
Coronavirus preventative measures need to be preserved or be expanded. Somewhere it is possible to plan the reasonable lifting, but only based on the opinion of scientists and specialists, while taking into account all factors and possible risks. I emphasize again that we must not rush to lift coronavirus-related restrictions. Any negligence or haste can result into a breakdown or a step backward. The price of the slightest mistake is the safety, lives, and health of our people.
Putin's approval rating has dropped to 59%, the lowest it's been in 20 years. For more, we go to Moscow, where we're joined by Joshua Yaffa. He's the New Yorker's Moscow correspondent and the author of Between Two Fires: Truth, Ambition, and Compromise in Putin's Russia. Welcome to Democracy Now! Joshua, it's great to have you with us. Why don't you just lay out the landscape for us during this pandemic? How has Russia been affected as we hear about 10,000 new infections in the last 24 hours?
Sure. The trajectory, as much as you outlined in your introduction, throughout March, Russia looked like it had and did have a relatively low number of at least officially recognized cases at a time when cases were spiking in much of Europe and beginning to spike in the U.S., New York especially. Russia had a few hundred cases, and it looked like either Russia was going to get a delayed the national level epidemic in Russia would come with some delay, or maybe Russia might avoid the worst effects of the pandemic, as we've actually seen in some countries in Central and Eastern Europe. A month and change later, it now seems that the answer is pretty clear. It's that Russia just was a bit slower in dealing with or facing the full brunt of this pandemic, but it's facing it quite dramatically with statistics that you laid out in the introduction. The rate of growth of new cases is now second in the world only to the United States, a kind of superpower competition that neither side, I'm sure, wants to be winning. But with over 10,000 new cases announced every day, that puts Russia in the number 2 position, bringing its total number of cases to over 177,000, also putting Russia in the top, I think, 6 or 7 for overall cases throughout the entirety of this pandemic. And it remains largely, though not exclusively, a Moscow phenomenon. Like in London in the UK and New York in the US, the capital and major globally connected metropolis is the epicenter of the epidemic. About half or even more of all known cases in Russia are in Moscow, and every day when that new case count is released, about half or more are Moscow cases. So it's very much a tale of two countries. You have Moscow, which is being extraordinarily hard hit, and then you have the rest of the country where you do have isolated pockets of infection. I wrote a story for The New Yorker last week about infection clusters that were breaking out at some of the remote oil and gas fields in Siberia and the far north in the Arctic, where you have workers living in very cramped conditions, turning those work sites into hotspots. And I think that's the main worry for the Russian government going forward, is how much does coronavirus on the Russian scale continue to be a Moscow issue, and how much does it turn into a nationwide one, like in so many capital cities around the world. But I think in Russia, all the more dramatically, Moscow is a very different place than the rest of Russia, especially when it comes to things like infrastructure, per capita spending on healthcare and other measures, transport, other infrastructure questions. So you haven't necessarily seen Moscow hospitals stretched beyond the breaking point. They have been pushed to their limit. You've seen announcements from hospital directors, as well as more informal announcements on social media and elsewhere from doctors themselves about being pushed really up into the limit. But still, perhaps Moscow hospitals are able to manage even this spiking caseload. That's a different story entirely when it gets to the provincial regions in Russia. And if the national scale epidemic begins to filter out into the regions in big numbers, I think that's going to be a much more dangerous and potentially disastrous story for Russia.
Joshua, in a piece that you wrote earlier this year in March, you talked about various people whom you'd spoken to in different parts of Russia who told of having coronavirus symptoms, attempting to get tested, and not being able to be tested for coronavirus. Now, we know testing has been a major problem across the world, including, of course, in the US. So could you say a little now about what access to testing is like in Russia, and to what extent that accounts for reports of these 10,000 infections, for example, in the last 24 hours?
Sure. Like you mentioned, testing was a problem in Russia in early and mid-March, just like it was a problem everywhere. There didn't seem to be many countries in the world at that period that were able to keep up with testing demand. And indeed, I heard lots of cases of people who seemed to be suffering from the classic, as we now know them, coronavirus symptoms, who weren't able to get a test. Testing is far from perfect now, but it's certainly been ramped up extensively. Moscow City is claiming that it's doing about 40, I think, or 50,000 tests a day. Testing has become much more widespread, while still not coming anywhere close to capturing the actual need. The Moscow city government does put forward this argument that the reason you're seeing such a spike in cases is that now the testing resources and the ability to test has been built up to a level where they can go out into the population and test people. And so the numbers are not necessarily are reflective of increased testing rather than a spiking spread of the virus. But that's impossible to check. The Moscow city government, very much a part of the Kremlin overall political machine run by Mayor Sergei Sobyanin, who's very much a loyal member of Putin's political inner circle, even as this Mayor Sobyanin has emerged as a somewhat, if not exactly independent, then a kind of parallel voice and source of authority in dealing with coronavirus, at least here in Moscow. But very hard to fact check some of these claims coming out of the Moscow city government. But that does say, the Moscow city government is saying, for example, that about half the cases being identified these days, people testing positive, are asymptomatic. In other words, that suggests, at least in Moscow, the testing is able to get out into wider segments of the population, not just people who are showing up at hospitals who are sick. And we've also seen relatively young ages of those testing positive, people under 40 or 50, which also suggests that it's not just the very sick who are being tested, but there's a kind of proactive testing regime. Though, just like everywhere, as I've been saying, it's obvious that the official numbers, people who've tested positive, nowhere matches the real caseload. And you even had Moscow's mayor, Sobyanin, this figure I've referred to today in an interview, reveal that according to his own or the mayor's office's own estimations, the real number of those infected in Moscow alone is about 2 or 2.5% of the population. So 300,000 people. That's more than 3 times the 80,000 people who are officially registered as coronavirus positive in the capital.
And Joshua, could you also talk about the cuts that were made to Russia's healthcare service and how that's impacted Russia's response to this crisis? I mean, there have been reports of ambulance drivers having to wait for hours outside emergency wards before the patients that they have in the ambulances are let in.
Sure. Like I said, the story of Russian healthcare really varies whether you're talking about the center of Moscow or the regions. And those provincial regions have been especially hard hit by a series of reforms that are known or were called somewhat euphemistically Orwellian optimization. There was an optimization, in quotes, program in the Russian healthcare system in recent years, which resulted in, among other things, the closing of regional and provincial healthcare centers, merging of various hospitals into one, essentially depriving localities that had long had a hospital or a clinic in their areas, leaving them without one, forcing people to travel further distances. So all of that, of course, weighs very heavily in a negative way when you have a global pandemic hit the country. And I think that's why it will be so important and potentially disastrous if this goes the wrong way. If the virus reaches into those provincial locations, you just don't have hospitals and doctors who are equipped to deal with them. You've already had a number of doctors in the regions make appeals through social media and elsewhere talking about the lack of protective equipment, being forced to work excruciatingly long shifts without the necessary safety measures and without the necessary equipment and gear in the hospitals to treat and care for patients. So healthcare has really been an area that's, if not been neglected, maybe you could say was even targeted actually for budget cuts and austerity in Russia in the past several years, which again leaves them in a very vulnerable way in terms of dealing with coronavirus.
Joshua, could you talk about these 3 doctors that, mysteriously fell out of hospital windows after complaining about the lack of protective gear? Talk about where this happened and what's happening with doctors. 2 of them died. 1 of them is in critical condition.
Sure. That's happened. There's one case just outside of Moscow, another one in Siberia, and a third, I believe, down in southern Russia. As you said, all those doctors in some way either spoke out about what they were observing with coronavirus in their own facilities. In the case of this young ambulance driver, recorded a video talking about the lack of protective equipment. Quite curiously, he then surfaced, this is before his fall, to record another video in which he took back his words, leading many to believe he had been pressured by the authorities or his higher-ups into recording that second video in which he recanted his earlier criticisms. Other than that, though, it's very hard to say what exactly happened in those 3 cases. I know myself and other journalists, both Western and Russian, have been looking into those cases, trying to talk with friends, colleagues, doctors who cared for these individuals to try and understand what the circumstances of these, whether they were accidents or something more nefarious. I think it's worth remembering that sadly and tragically, suicides of doctors, nurses, and other healthcare workers is a phenomenon we're seeing in the West. There's been a number of cases in the UK. There's been a number of cases in the US as well. So there is a dark precedent for medical personnel taking their own lives, people who are at the front lines of dealing with coronavirus. But as to what actually happened in these 3 cases, we just don't have enough information yet. As I said, I know myself and other people are trying to get to the bottom of these cases, but to say anything more would just be speculation, frankly, at this point.
And let me ask you about Putin himself and his whole approach to this. I mean, of course, here in the United States, we're the epicenter of the pandemic in the world. But Russia is moving up quickly. It has the highest rate of new infections in Europe, the 2nd highest in the world. Can you talk about how he responded at first and then overall as you're saying, the difference between what's happening in Moscow, where the infection rate is considered extremely high, and in other places, even in the closed cities, for example, that make plutonium, where we hardly know anything about them, what would be happening now?
Sure. You know, what's been interesting to observe for people like myself who watch Russia closely and watch Putin closely is how hands-off, almost absent he's been at various points of these crises. We're used to thinking of Putin as this very decisive, almost omnipotent leader who inserts himself into any crisis and extracts maximal personal advantage from it by being the one who is seen to, in his own way, resolve that crisis again to his advantage. And we haven't seen that here. Putin actually has taken a somewhat backseat or allowed himself very conspicuously to take a backseat, putting other people in charge. You mentioned the Prime Minister, Mishustin, who now himself has come down with coronavirus and is at a hospital in Moscow, as well as the Moscow mayor, Sobyanin, who's really emerged as one of the more forceful or at least visible government officials in dealing with coronavirus. You know, I've heard various explanations for why Putin has chosen to, at least relatively speaking, sit this one out or not seize the reins in the way we have seen him in previous crises. One explanation is that essentially at this stage in Putin's rule, 20 years in, he sees himself as a kind of historic, almost messianic figure. What interests him are the questions of big geopolitics, engaging in negotiations with the OPEC cartel, managing Trump, reasserting Russian will and influence in Europe, and that the virus to him has seemed a kind of technical question, not totally on the level that he sees his own rule at this point. Another reason, it just gets to the nature of Machiavellian political calculation. There's no guarantee, as we've seen in recent days, that the virus is going to decrease or in some way dissipate in Russia anytime soon. The effects could be very damaging, not just the health effects, but in fact, the economic effects. Russia is expected to go into recession this year. The coronavirus global downturn paired with the collapse in oil prices is hitting the Russian economy especially hard. So it's quite possible that Putin decided that being in charge right now is a kind of poisoned chalice, that you're only actually likely to lose popularity and legitimacy. And so he's purposely allowing other officials to take the lead and therefore potentially take the blame. But it has been interesting to see how Putin has not been front and center here, but again, let these other officials lead, or rather not even lead, because there isn't really a coherent nationwide strategy. It's hard to talk about one top-down policy flowing from Putin and the Kremlin all the way around the country, which leads to, as you alluded to in your question, we've talked a bit about very disparate and kind of helter-skelter outbreaks throughout the country. Moscow, of course, is the country's main hotspot. But beyond that, you see these outcroppings of cases in places like the remote oil and gas fields of Siberia and the Arctic, a number of regional hospitals, including in the Komi Republic, a northern republic near the Arctic Circle. Hospitals there became kind of super spreading locations of the virus, like we've seen, sadly, in lots of other countries. So the virus is popping up in somewhat random and unexpected places throughout the rest of the country. And if those points begin to connect, and if the virus really seeps in to the regions in a more widespread way, as we've been saying, that could be something that proves even more difficult for the Russian authorities to manage than a local or national epidemic that so far is largely Moscow-based.
And Joshua, I want to ask about the kind of response from Russians to how the government has dealt with this crisis. There are dozens of online protests demanding greater financial assistance and compensation. A fifth of employees, 20% of employees in Russia have already lost their jobs or are on unpaid leave. What kind of financial safety net has the government provided? And then second, you mentioned the economic impact of this crisis and the oil industry. I mean, the oil industry in Russia employs, I think, something like 1 million workers. So could you talk about both these things? What kind of safety net the Russian government has provided for those who have lost their jobs, and the impact of the combination of the collapse of the oil prices and the coronavirus emergency?
Sure. To your first question, there frankly haven't been many measures at all, which is leading, in my estimation, more to the downtick in Putin's popularity, not the spread of the virus itself, but rather the spillover economic effects that aren't really being dealt with in a coherent top-down way. I think that's proving more, taking more of a hit on Putin's rating than even the virus. As I talked about in the answer to my previous question, in Putin's somewhat absent or not very forceful response, what he's done is he's announced a series of so-called non-working holidays for the country. These aren't official quarantines. That's left up to governors and mayors. It's Moscow's mayor, who I've been talking about, who actually decreed that in the city of Moscow there would be a quarantine. All Putin has done is announced these rolling series of non-working holidays. And what that means is that the government does not obligate itself to pay any sort of wide-scale compensation, not to employers and not to employees. Putin has said no one should lose their job as a result of this crisis, that all employers should continue to pay salaries. But with the Russian government not providing wide-scale economic relief for those employers, for small and medium businesses, there simply isn't any money to pay those employees. So it's a bit of a paradox that the Kremlin hasn't really resolved. And I think it's growing economic frustrations that are leading to that sort of, if not exactly protest mood, because there isn't really anywhere or any way to protest right now. And that may be one thing that helps the Kremlin squeak through this crisis, even if support for Putin and its policies continue to fall. It's not just difficult, but impossible to gather people in the street right now for a protest. As to the question about oil, I think what's more important financially for Russia is not even the amount of people employed in the oil and gas sector. Relatively speaking, the extraction of oil and gas is a pretty labor-unintensive enterprise compared to other forms of economic activity. But it's extraordinarily important for the Russian budget. And I believe half or more than half of all Russian workers, one way or another, depend on the Russian budget. They could be considered state employees in one form or another. So having money in the federal budget to then distribute around the country, that's what's extraordinarily important. Historically, or in recent years, the Russian budget has been balanced, I think, at about $40 or $45 per barrel of oil. Of course, oil has gone much lower than that in recent weeks, stabilized a bit. But if oil stays low for a considerable amount of time, that's going to really take a big chunk out of the Russian budget. And it's the ability to spread that budget money around the country that has been an important factor for 20 years of relative, if not stability, then at least longevity of the Putin system.
Joshua Yaffe, we want to thank you so much for being with us, Moscow correspondent for The New Yorker magazine, author of Between Two Fires, Truth, Ambition, and Compromise in Putin's Russia. When we come back, we look at patents versus the pandemic. We'll speak with a writer who says we'll find a treatment for coronavirus, but drug companies will decide who gets it. Stay with us. We're going to Bangalore, India.
Caía a tarde, feito viaduto, e bêbado trajando luto, me lembrou Carlitos, a lua, tal qual a dona do bordel, pedia a cada estrela brilho de aluguel e nuvens lá no mata-borrão do céu chupavam manchas torturadas. Que isso foi?
The Drunk and the Equilibrists, sung by Elis Regina and composed by the great Brazilian songwriter Aldir Blanc, who died Monday at the age of 73 from COVID-19. This is Democracy Now!, DemocracyNow.org, The Quarantine Report. I'm Amy Goodman with Nermeen Sheikh. As the global death toll from COVID-19 tops more than 265,000 and confirmed cases worldwide approach 4 million, though it's clear they're much higher, the head of the World Health Organization has urged the world to unite to defeat the disease.
But just as the number of new cases and deaths is declining in some countries, it's mounting in others. This virus will be with us for a long time, and we must come together to develop and share the tools to defeat it.
This comes as new clinical trials by the National Institutes of Health of the experimental antiviral drug remdesivir show it reduced hospitalization stays for people infected by the coronavirus from something like 15 to 11 days compared to a placebo treatment, but did not significantly improve survival. Meanwhile, the Food and Drug Administration granted authorization Friday to pharmaceutical giant Gilead Sciences for emergency use of remdesivir to treat patients with COVID-19, paving the way for broader use. President Trump announced the news from the Oval Office, joined by Gilead's chief executive, Daniel O'Day. This is O'Day.
We want to make sure nothing gets in the way of these patients getting the medicine, so we made a decision to donate about 1.5 million vials of remdesivir.
Gilead's donation is expected to be enough to treat at least 140,000 patients, depending on the number of days they need to be treated. A draft government report projects COVID-19 cases will surge to about 200,000 per day by June 1st. Gilead started developing remdesivir in 2010 as a potential Ebola treatment and has patent exclusivity for the next 15 years. Analysts say the company's total revenue from the drug could top $11 billion if it's a successful treatment for COVID-19. In March, Gilead sought an orphan drug designation from the FDA for remdesivir, a class given to treatments for rare diseases, but rescinded its request after public outcry. It recently spent a company record of $2.45 million in the first quarter to lobby Congress and the White House. Some members of Congress are now asking how much consumers will pay for the drug. For more on how much drugs like remdesivir will cost and who gets access to them, we're joined by Ashel Prabhala, coordinator of the Access IBSA project, which campaigns for access to medicines in India, Brazil, and South Africa, wrote a piece with Nobel Prize-winning economist Joseph Stiglitz on patents versus the pandemic. And his recent piece for The Guardian's headlined, "We'll find a treatment for coronavirus, but drug companies will decide who gets it." He's joining us from Bangalore, India. Welcome to Democracy Now! So if you could fully explain, in using the case study of remdesivir, who profits, who gets access, and how important is this drug?
Thank you very much, Amy. The situation with remdesivir is very, very interesting because it's the first treatment to have been approved by the FDA for use against COVID-19. I think everyone agrees that it's not a miracle treatment. The medical consensus is that it's a great first treatment. It's by no means the last, and we'll see more coming out as clinical trials conclude. Remdesivir is owned by Gilead, and I was stunned to hear Daniel O'Day, the CEO, repeat on your show that he will do his best to make Gilead available to everyone around the world, and that he had donated a large number of treatments to the United States. Because Gilead's track record in delivering access to medicines, not just in the United States, but elsewhere, has been horrible. The Trump administration is actually, coincidentally, suing Gilead for the unauthorized use of U.S. government patents from the CDC that are used in a drug that Gilead calls Truvada. Truvada is PrEP. It's what many sexually active gay men can take as a preventive measure against HIV and AIDS. The drug costs $25 a month to take in India, and the price in the United States is $1,800, which obviously acts as a deterrent to buying that drug and therefore constitutes a public health hazard. Their track record in Brazil has been equally abysmal. They brought to market in 2013 a drug called sofosbuvir, they call it Sovaldi, which is the first ever treatment designed against hepatitis C, which is a debilitating and fatal disease that affects many people in middle-income countries like Brazil and the former Soviet Union. But 6 years after they introduced it, in 2019, the cost of the drug, it was $84,000 a year, which meant that the Brazilian government simply couldn't afford to buy enough of it. It meant that 14% of all Brazilians who needed that drug in what was a well-funded public health system could get it, while the rest and many died on the way, while the Brazilian government battled Gilead for more access to this excellent cure for hepatitis C. So Gilead's track record is highly suspect. And the fact is that patents and monopolies that pharmaceutical companies own have been hobbling the lives of people in developing countries, in poor countries, for at least 3 decades. It's only in the last 4 or 5 years that there's been a visible impact that these pharmaceutical monopolies have had in richer countries, especially those without a universal healthcare system like the United States. And I'm glad that there is more and more action on this issue now in countries where much of the lobbying and much of the marketing and much of the stock market value of these companies is based, because that indicates that perhaps there will finally be some action on reining in these pharmaceutical monopolies, both by societies as well as the states that actually allow these monopolies to exist.
Achal, you talked about Gilead's record with both hepatitis C medicine as well as HIV/AIDS, but one of it's not just Gilead, of course, that has these patents and overprices the drugs, life-saving drugs. I mean, one of the most stunning examples is, of course, as you know, pneumonia, for which a vaccine has long existed, over which Pfizer Pharmaceuticals holds the patent, and still 100,000 children below the age of 5 die every year in India alone from pneumonia. So could you talk about the steps that the international community, multilateral organizations like the WHO have taken to limit the power of pharmaceutical companies in having these patents and setting these exorbitant drug prices that have such lethal consequences around the world, but especially in the developing world?
I'll start with the last part of your question, which is what steps have states taken historically to rein in these drug prices? And the answer is very little. What steps have the UN organizations like the WHO taken? A little more. They could do a lot more. The truth is that a lot of us hold out hope for when this pandemic will end, thinking that it'll end when treatments and vaccines emerge, when a cure emerges. But my experience and our experience in poorer parts of the world, we know bitterly that, in fact, the fight begins once a treatment or a vaccine emerges. The distance between Washington, D.C. and Johannesburg is about 8,000 miles. It took 8 years between 1996 and 2004 for AIDS drugs which turned a death sentence into a chronic condition, to travel that distance, which takes 16 hours by plane, while millions died simply because of monopoly prices that had to be dismantled and reined in. The PCV vaccine that you bring up is a very, very interesting and tragic example of the ways in which vaccines fail. It is the monopoly property of Pfizer. The newest version of the vaccine is PCV13. Pfizer calls it Prevnar in the United States. Funnily enough, it's Pfizer's single biggest revenue-earning product. Over the last 5 years, it's brought in $5 billion in revenue every single year, which is a funny thing because Pfizer is a company that we associate with drugs like Lipitor and Viagra. But in fact, it's a vaccine, and it's a vaccine against pneumonia that is the single biggest revenue generator for this giant pharmaceutical company. Pfizer sells the vaccine at about $850 a course in the United States. They offer it through Gavi, which is the vaccines initiative, at a subsidized price to the Indian government at $10 a course. The problem is that $10 a course represents the highest price that the Indian government pays for any vaccine. It's 20 to 30 times more expensive than any other vaccines that they procure. And as a result, the government can only afford to buy enough to treat a very small proportion of the children who need it. And as a result, tragically, there are over 100,000 deaths recorded, infant deaths from pneumonia, which is a perfectly preventable condition. It's been preventable since the 1980s, but it still continues. So in fact, the journey from New York to Delhi, which is also 8,000 miles, which should take 16 hours, is actually infinite. We haven't even made that journey as yet. And this is instructive for COVID-19 because of any treatments and vaccines that come out of the billions of dollars that is being thrown at pharmaceutical companies. Something like 75% of all money that has been pledged by rich country governments, the EU and the US, has gone to private corporations. Not a single dollar or euro of that money comes with any stipulations for access. So you have people like the Gilead CEO saying nice things about access and saying, trust us, which is difficult to do given his record and his company's record. And you have leaders of the EU saying, again, somewhat meaningless platitudes around access and making sure that poor people in developing countries will be able to access the drugs and the vaccines. But we know from history that that's just not true. Unfortunately, there is a very easy way to guarantee access, which is to simply strip all monopolies of any product that is created for the detection or treatment of COVID-19. But none of the agreements that the governments have signed with pharmaceutical companies, which again run into the billions of dollars, mention anything about patents or monopolies or access. And that should be very worrying to us.
I mean, there's a precedent for this. Jonas Salk on the polio vaccine, right? I mean, he famously said, when asked by Edward Murrow, who owns the patents, he said, I would say, there is no patent. Could you patent the sun? And what a difference the polio vaccine meant for so many. Could you end by talking about Access IBSA, your group, India, Brazil, South Africa, what this means, what you're fighting for, and do you think you can win?
Look, I'm so happy you brought up Jonas Salk, because Jonas Salk is not just responsible for the creation of the polio vaccine, which of course changed the course of humanity. He was also responsible for the first flu vaccine, which came out of similar mid-20th century efforts in the United States, which were very publicly oriented. They were funded publicly, sometimes by actual citizens mailing in checks. And definitely by governments who, at that time, during the World War II and during the World Wars, were most keen on protecting their soldiers who were out on the battlefront. The original flu vaccine, by the way, which billions of us have taken over many decades, is a publicly funded effort which didn't have any intellectual property protection and has been run since the 1970s out of a wonderful network at the WHO in Geneva, which releases 2 recommendations annually that set out what strains of the flu virus should go in. It's a collaborative effort, 110 countries, governments collaborate, and anyone then can manufacture the vaccine based on their formula. The UN just set out in one of its many complicatedly worded resolutions that they intend every treatment and vaccine for COVID-19 to get to everyone everywhere. That can only happen if the vaccines and treatments can be manufactured by everyone, everywhere.
Achal Prabhala, we want to thank you so much for being with us, coordinator of the Access IBSA project, authored a piece with Nobel Prize-winning economist Joseph Stiglitz on patents versus the pandemic, which we will link to, as well as your garden story. We'll find a treatment of coronavirus, but drug companies will decide who gets it.